Now, World Cancer Day, observed annually on February 4th, is a global initiative led by the Union for International Cancer Control to raise awareness, promote prevention, and improve cancer care worldwide. The 2025-2027 theme, United by Unique, emphasizes personalized, patient-centered care and recognizes that while every cancer journey is different, the hope for healing is shared by all. The day aims to reduce preventable cancer deaths. Up to 4 in 10 cases are avoidable through early detection and lifestyle changes, and fight stigma by encouraging governments and individuals to take action. Since its establishment in 2000, World Cancer Day has grown into a worldwide movement involving awareness campaigns, events, and initiatives such as the 2026 Upside Down Challenge, which highlight how cancer disrupts lives. The focus remains on fostering empathy, improving access to treatment, and building stronger support systems for patients and their families. Now, Chief Clinical Coordinator, MedServ Luth Cancer Center, Dr. Mohammed Yakub Habeebu, joins us now for a conversation about the health concerns raised by the prevalence of cancer. Welcome to the show. Thank you for joining us.
Thank you. Welcome.
Now, we know that February 4th is a day set aside to talk about and raise awareness about cancer, especially in a country like Nigeria. How significant is this commemoration?
It is very significant. Like you rightly said, the theme is United by Unique. The low and middle income countries, which Nigeria is one of them, face a greater challenge and a greater burden of cancer. And there is need, since about 40% is preventable, there is need to enlighten the populace so that we can achieve prevention in 40% of cancer burden.
Very good, Dr. Habeebu. Now, there's an abundance of cancer awareness programs annually, but what happens afterwards? Does it translate to better prevention, or there's an uptick in cancer cases generally, you think?
Well, it has not significantly increased the uptake of habits and that prevent cancer burden, but we are improving, the uptake by this, public message.
Now, we know that this year's theme is United by Unique. What does that mean? How does it improve maybe treatment or ensuring that we now focus on individual cases of cancer?
Yes, the uniqueness emphasizes the uniqueness of the cancer disease. For example, in the low and medium income countries, most of our patients present very late. And that's due to many factors, including low social capacity, that's lack of fund, low education, stigmatization, lack of manpower, lack of infrastructure, lack of screening. And unitedly, every cancer patient hopes for cure. So we have to emphasize on the habits that can improve early detection and reduce the risk of cancer so that we can achieve cure, which is all united we want.
Indeed, doctor. So what are the commonest forms of cancer you've come across in MedServ Luth Center? And is treatment effective when these cases are reported early enough, you think?
Yes, the commonest cancer cases we've come across in MedServ Luth Cancer Center are the commonest cancer in this part of the world. That's in Nigeria. Breast cancer is unarguably the most common cancer we see, and it accounts for about 30%. That's about 1 in every 3 cancer cases we see. While cervical cancer is second in women, accounting for about 17%. But prostate cancer is the most common in men, accounting for about 16% of cancer cases. Habits can greatly improve the outcome of this cancer. What do I mean? Early detection is key to cure for cancer. So the only way you can track cancer as early as possible is via screening. You must be able to screen so that you are able to detect this cancer even without the symptoms, because most often than not, when we start having symptoms of cancer, the cancer is already advancing.
So talk to us about the early symptoms, what are the signs you should see that would tell you to, get medical attention?
Yes, that depends on the type of cancer. Different cancer, all the cancer have their own signs and symptoms. The commonest, which is breast, usually occur in middle and elderly women, especially if there is no familiarity. If there is familiarity, it does. If you have cancer in the family, breast cancer in the family, then it will occur earlier, usually around 40. Now, breast lump is the most common. Breast lump, which if it is unattended to, continue to grow and eventually could form a crust or could form a sore. That's an open wound, a chronic open wound, or could invade the skin or even spread to other parts of the body like the lungs, causing chest, cough, and also may cause weight loss. Bloody discharge from the nipple can also be a presentation of breast cancer. But some breast cancer affects the skin and it will present like eczema, even though not very common. For cervical cancer, usually it's more in postmenopausal women, that's women that has reached menopause, even though it can affect women before they reach menopause. But most often than not, you will see a woman that has reached menopause complaining that starts seeing blood again. It's as if it's menstruating again. But also postcoital bleeding could be a presentation, and dyspareunia, what we call painful during when you are meeting, that can also be a sign of cervical cancer. And some will be irregular bleeding. Instead of the normal period, they start seeing blood all along. For prostate cancer, most of the time it presents with difficulty in passing urine. It could be passing blood in urine. It could be hesitancy. When you get to toilet, you are unable to pass the urine, you hesitate. And it could even be back pain or leg pain in men. This is when it has spread. And often you could see the man losing weight or looking older than his age, and this could also be part of the presentation of prostate cancer. But interestingly, these are three cancers. They have screening methods which we can employ, and even cervical cancer can be prevented by giving vaccines. You give vaccines to youth, that's adolescents, and mainly both boys and girls, and that will prevent the infection with human papilloma virus. It's a virus that is the culprit that causes cervical cancer. So if you can eliminate the chance of having that virus, then you are going probably to eliminate cervical cancer. Prostate cancer on its own, there is what we call PSA, prostate-specific antigen, that rises when there's any problem with the prostate, will be it enlargement or infection or cancer. But with cancer, usually it rises very high, usually, not all the time. So if you see a patient or a person with high PSA, then you go and investigate further. Breast cancer can be prevented by what we call either a breast self-examination, where the woman examines her breast. It could be trained to examine the breast. Use the left hand to examine the breast and the armpit, the right to examine the left breast and the armpit. And there is also what we call clinical breast examination, where she goes to the hospital to see a trained nurse or a medical doctor. And they are able, because they are well trained, they are better at diagnosing the lump and breast disease. And then we could also do imaging. Imaging entails either breast ultrasound scan, which is better in younger women, or mammogram, which is better in older women. And if anything is seen, then you do a biopsy. It could be fine needle aspiration biopsy. Just put a needle, take a sample, take it to the lab, and see the cells that are there. If it is malignant, that's if it's cancerous, we quickly detect it even before any sign and symptoms. These three screening methods, well employed, will solve 40% of mortality of breast cancer in Nigeria.
All right, it's heartwarming to know that at least there are several screening options regarding cancer. But what would you say to those who have likened cancer to more or less a death sentence despite treatment options, you think?
It's lack of awareness and misinformation. Breast cancer or any form of cancer, most cancers, let me just put it, generally most cancers can be cured when detected very early. The challenge is when it's stage 4. That's when it has spread. We normally use the word metastasize. When it has spread, then cure becomes very evasive. However, we could still elongate the lifespan. That's we treat to prolong the life, and we can still treat to minimize the burden. That's to relieve the pains of the patient. But when caught early, almost any cancer will be cured.
Okay, so talk to us about the biggest challenges facing cancer care in Nigeria and how affordable is treatment.
Yeah, the socio-economic factor is one of the greatest challenge, and we can to an extent link most of the other factors to socio-economic factors. Factors like education, poor information on screening, lack of availability of centers. We in this country of over maybe 220 million, or is it 230 million now? Well-equipped centers that we have in this country, I'm not sure there are more than 10 centers that can do everything you need to do. MedServ Cancer Center is very well equipped, but the government is trying to, improve the other centers in the 6 geopolitical zone, and MedServ is doing a good job in training, staffs from those centers. Again, where are these centers? They are usually at the city. Most of the rural areas don't have centers, so the distance is another challenge. Lack of education about screening is a challenge. Then the myth that cancer is a death sentence is a big challenge. Then the myth that the treatment for cancer, which is chemotherapy and radiotherapy, kills more than the cancer, is a bigger challenge. So Japa syndrome, that's migration of health workers. That is making it even more complex. So we have a lot of a gamut of problem, that is preventing the cure of cancer in this part of the world.
All right. Finally, before we let you go, Doctor, but despite all these challenges, what are the success stories like in cancer care in Nigeria's health system, you think?
There's a bit of reversal. We're having reversal of medical tourism, especially in the MedServ cancer centers. We are seeing Nigerians come from abroad. Those who have long time delay over there, they come here. They get it done at a cheaper rate if you compare it to what they will do abroad. We are seeing some of our politicians who would have had to gone out. And we are gradually seeing patients come earlier than before, because the news, some people who get treated and are okay, they go out to spread the news that they have been treated, and so they bring their colleagues who have it, they bring family, their friends, those who have it, they refer them to us, and we are gradually seeing a change. And also know that there's a CAP program now, that's a chemotherapy access program by government, even though it's not yet robust, but it will grow, and over time our patients will be able to access treatment either with freely for chemotherapy or at a subsidized rate. And I want to believe over time this will expand to cover other forms of treatment.
Indeed, because of course people have to be able to afford the treatment for them to come to the hospital. But thank you so much for the work you're doing. Chief Clinical Coordinator, MedServ Cancer Center, Dr. Mohammed Yakub. United by Unique. That's the theme for this year. And we hope that we're able to reduce the prevalence of cancer in Nigeria.